Welcome to Wide AF. You're listening to your hosts, Steph and Brandon. Today we're going to be talking about rehab do's and don'ts, specifically exercise rehab and prehab as well. So we find that a lot of people kind of forget about doing their rehab exercises or prehab exercises to prevent injury or to recover from injury.
I've become really good with rehab and prehab since you've been on my case about it, but there's definitely been times where I haven't put so much energy into those accessory movements or those movements that are probably going to contribute to my recovery the most, and instead kind of push through that pain, which is something that we see people do all the time.
Yeah, and it's not normal to have pain while you're training. So it's really important that if you are seeing someone, osteo, physio, chiro, and they give you exercises, which they should, because research is really backing exercise at the moment to help injury, prevention and recovery. But if you're not doing your exercises, you can't really expect to get the best result. So
we find it's super common for people to go and get a massage or go and see a myotherapist if they've got a sore back or a sore knee. Regardless of how long they've had that sore back or sore knee, they'll just go, oh yeah, come and fix me. Where the reality is that's not going to be your road to recovery. That might be something that you get, once a month or even longer, but something to relax you or for different reasons.
Yeah, those modalities, they're awesome. I'm not against them because I use them. I use manual therapy treatments, massage and adjustments and manipulations and things like that. I think they're great and they can get really good benefit for people, especially if, they need that little bit of extra help moving their joints and relaxing muscles. And hands-on therapy can just be really therapeutic for people and help them relax and de-stress as well. So I'm not against that. I'm totally for that. But keep in mind that it is a passive treatment. So that means that the patient doesn't have to do anything. So, you kind of lie on the table and your therapist does it all for you.
I think that's the attraction.
Yeah. And then you walk out and you're like, oh, I feel so much better, hopefully. So that's great because you don't have to do anything. You just pay your money and you feel better. But the long-term benefits are not as great. It's just that short-term benefit and that short-term relief. So exercise and rehab is a long-term benefit that's going to help you come back from injury and prevent injury down the track.
Before we get any further, we just want to say a big disclaimer that the pain that you experience when you're doing, when you have an injury or something like that, isn't an indication of the damage that you've done. So just to be, just to put that out there. It's kind of something that we've said in heaps and heaps of episodes, but just to keep reminding you guys, the pain that you're feeling isn't an indication of the damage that you've done.
I love that you know this. Clearly me and Brandon have done lots of talks about pain education, but this is something that was drilled into us at uni as well, talking about pain and what it means. And you're on board with this now too, so you understand it a bit more. But it's not just because you feel a lot of pain doesn't mean there's a lot of damage to the tissue. Your pain's still real, but just know that there's not always the severe damage that you might think that there is, even if the pain feels really extreme, and vice versa. You might not feel any pain at all and you might have a serious injury. So just keep that in mind.
Perfect.
Let's get into our do's and don'ts of exercise rehab. So number one, we're going to start with a don't. Don't expect your injury to get better overnight. So there's no quick fix. There's ups and downs. It takes time. It took a while for you to probably get the injury for some people. It's not like it just happened. I mean, some of them it does. If you got knocked by on a footy field and someone knocked your knee, that happened pretty quickly. But, a lot of overuse injuries, they take time to happen. So you can't expect it to literally get better the next day when you start exercising or doing your rehab.
Yeah, things like tendonitis and those tendinopathies, they can be really, really... Steph, you can explain to everyone what a tendinopathy is?
Oh, yeah. So tendinopathy is where your tendon becomes inflamed for a long period of time. Tendonitis is a bit more acute, where it's still inflamed and it's an active inflammation at the moment. So the tendon, which is the muscle connecting to the bone, that can become inflamed. So tendonitis, tendinopathy, pretty much the same thing. It's just that one's been happening for longer and one's a little bit more acute.
So those things, they can be really annoying and really nasty and take quite a bit of time to recover. So if you're not on top of things and you're not on top of your recovery, they can take even longer. So it's really important to, get started with something like tendonitis. Don't expect it to be fully recovered and go back to 100% training in 2 days, 2 weeks, or if you feel good after you had a treatment, then max out the next day on that area that's feeling really sore. I know I've done that a lot.
You're speaking from experience with these things.
Yeah, a lot of things with training, there's a lot of unknowns, and with exercise, we've done training, so we know what it's like. If you do something like this for long enough, just by chance or just because you push your body pretty hard, chances are you're probably going to get, some little niggles at some point. It's fairly normal to experience that, but how you recover from that is obviously up to you, and that's going to depend a lot on your attitude in training. So don't expect it to be, all rosy as soon as you get one treatment or as soon as you start doing those rehab movements.
Mm-hmm. Yep, exactly. So you do need to communicate. Communication is so important. We've discussed this before in training as well. If you have a coach, communicating with your coach is really important. Communicating with your health professional or anyone who is helping you with your training or your rehab at the moment, you need to talk to them and communicate with them.
Yeah, for sure. I think one of the things that's really important, and one of the things that I do with my clients, is I'll constantly check in on them, because a lot of people feel bad talking about it or feel bad bringing it up if they've got a sore shoulder or something like that. They won't even bring it up to me as their coach, where it's really important. And that's one of the most important things about having a coach, is being able to communicate really well. And Steph, we use like a little pain scale in order to kind of, articulate how's that feeling, and even that's really important to see if it's actually progressing as well.
Yep, exactly. Yeah. So you need to say, what's my pain level at today? What's the discomfort? Are you actually able to do the exercise plan? Are you pushing through it? It's not really working, or you need to let us know how those things are working, or is it not fitting with your lifestyle? Is it just too many exercises we've given you, or not enough exercises? Because everyone's going to be really different. So, I'm trying as an osteopath to tailor the exercise plan to the individual. Everyone's going to need different things. And I don't always know that unless you communicate with me. I'm going to try my best to understand what you need, but you have to tell us as well what you need and how you're feeling.
It's definitely a two-way street.
Oh, for sure. Yeah. The next one, this is very important, don't push through the pain. So some discomfort is to be expected. We just spoke about the pain scale. I use numbers out of 10, called a visual analog scale. So I usually say to people, if the pain is 3 out of 10 or less than 3 out of 10, that's okay. I'm okay for you to feel a little bit of discomfort. If it's getting over 3 out of 10, say 4 out of 10 during your rehab exercises, it's not really what we want. So make sure that if it is getting that over that 4 or 5, or it's just really bad, you don't need to do that exercise. And again, let us know.
And there's plenty of progressions that can be done. There's so many ways that you can load a joint without that area feeling pain. There's so many tricks. There's so many cheats in order to still get those muscles to work in a different way, in a different angle as well.
Yep, and that's our job. That's why we're here to help you. Coaches are here to help you. Allied health professionals are here to help you and modify. So use us, because that's what we're here for. We're here to help you.
Yeah, don't feel bad. Don't feel bad having to ask us, because that's our job.
Yeah, exactly. We want to help. And just remember as well that flare-ups are normal. So flare-ups will occur. If you're watching on YouTube, it's like a little graph going up and down with your recovery. It's not going to... That was me moving my hand up and down like a wave, for those of you just listening. It looked really funny on camera. Brandon's laughing at me.
It did.
So you'll have up and downs. You'll have days where it feels really good, and then days where it feels not so good. And then it'll improve, and then it will, be a little bit sore again. So just expect that. You might have a little bit of some flare-ups, but that's part of the journey, finding out what your flare-ups are and how you can manage them and work around them.
Yeah, it's definitely not a linear progression. And that's what we said at the beginning. Don't expect things to just improve dramatically. And with those exercises, I find, it takes time for those exercises to actually kick in and actually make those changes, because with training and with any kind of stimulus that we use, it's a delayed response. It's a delayed, we get those gains at a delayed time. So it takes time for you to improve. The squats that you do today, you might feel the strength benefits in 4 weeks, or that's why you start training before a comp. You don't just train the week of the comp.
Yeah.
Because it takes time to improve, and there's a bit of latency with that. Same thing goes with your rehab. The same principles apply with exercise. So, if you start with these strengthening exercises, whether it's a core exercise or whatever movement, you might find at the beginning it's quite challenging, and then it takes time for you to improve. And a lot of the times people will say, I don't know if that exercise is actually working for me.
Yeah.
Unfortunately, you might have to just stick with it maybe for just a little bit longer.
Sometimes, yeah.
And you might see the benefits of it.
Yeah, well, and sometimes as well, like there are neuromuscular changes that you don't always know that are happening. So like actually getting your brain to switch on with the muscle that maybe you're trying to work, or moving your body in a particular way that you're not used to, is going to take a bit of concentration, a little bit of coordination, and it might take a little bit for your brain to actually register, oh, this is the movement we're supposed to be doing. These are the muscles we need to switch on. This is how I need to position myself. So it might actually take a little bit in terms of like brain power and energy there, not just like the muscle strengthening as such, but the actual neural control as well is another component that takes time, because repetitions, the more you do something, the easier it's going to be. So if you've just started doing it, it's probably going to feel really foreign. And if you really need to do that exercise as well, if it's something that you don't do already, it's probably going to be really hard for you because you need it and you're not good at it. And then as you get better at it, you're going to improve those other areas. So, yeah.
Yeah, you're really good at assessing the areas. Well, for me, I speak from experience, at assessing the areas that I might struggle in and need to strengthen. So although I can do some lifts quite well, there are a lot of areas that are imbalanced and aren't as strong as certain areas. So, seeing you and assessing assessing areas that need to be, strengthened and what areas are kind of letting me down and causing things to take over is really important.
Yep, awesome. So then the next do that we have, another nice positive one, is do take your time. So we sort of already discussed this a little bit, but your progression might be really slow, but also take your time when you're actually completing the exercises as well.
That's the main one.
Yeah, we don't want to rush through them. It's not just, I have to do these exercises. I'll quickly do them in 2 minutes before my training session, or I'll just quickly do them at home before I go to bed. If you think about really like taking your time, breathing through those exercises, maybe it takes you 15 minutes. 15 minutes every day throughout the week, that's almost 2 hours worth of training and exercise. It's a really important time. It adds up. It's really beneficial.
Definitely. I think I've been starting most of my sessions doing some kind of movement that's going to help me, strengthen those areas. Doing a little bit of core work, doing a little bit of those accessory exercises isn't going to make your session, worse, but it's definitely going to go a long way in loading those joints in a different way that you might not be in your current program.
Mm-hmm, exactly. Then don't expect it to be easy. It's pretty big one. Don't expect it to be easy. It's probably not going to be easy.
No, I don't think so. I think a lot of the exercises given to me have been pretty hard, and I quite struggle with them, especially things where I have to, load my hip in a certain way. Even just L-sits, I suck at them so much. I am getting better.
Yeah.
But you can struggle with them quite a lot, but that's going to help you in the long run.
Yeah, I think a lot of people think, rehab or prehab exercises, yep, it's going to be really easy. It's activation. Sometimes it's activation, but often they're actually not easy exercises. No. Even some of the mobility stuff can feel really challenging. And that's, again, if someone's prescribing you those exercises, it's probably because you need it. And that's why it's hard, because you're not used to doing that movement, or not used to switching on that muscle, or your body doesn't usually move that way. So it's going to be difficult for you to do that. Also, you need these, I forgot to put this one on the list, but you want it to be specific, the stuff that you're doing. So, for an Olympic lifter, a lot of Olympic weightlifters are overhead athletes. Well, they are overhead athletes. So they need a specific strength training or rehab program that's going to focus on their sport. So you always want your rehab stuff to be focused specific on the sport you're doing. I guess it kind of leads on to the next point.
What's the next point?
Should I mention the next point now? So the next point was find an allied health professional or someone to help you.
So Steph means do find an allied health professional. Or was it don't?
My do's and don't list is all over the place.
God
It
damn
was do find an allied health professional. Yeah, so you want someone with that experience who's going to be able to make your rehab and prehab plan specific, like we just kind of mentioned. If you're doing a sport, then you want it to be functional to that sport. There's no point, doing this little external rotation movement with your arm if you're an overhead athlete. It just doesn't make any sense. So I was doing a little open and close movement with my arm for those of you listening and not watching.
Probably seen it.
Yeah. So, you want to make it specific. The same goes to everyday movements as well. Like if you're someone who it's painful when you're washing up on the clothesline to move your arm. So again, that's like a reaching movement with your arm. Why would you want to strengthen down low? It's not going to translate to up overhead. So you need the movements to be functional and translate into the movements that you're trying to get better at.
Awesome, definitely. Now I got a couple of questions for you, Steph.
Okay, I'm ready.
So these will be from the audience.
Yes.
So where do anti-inflammatories lie on this? And so, if someone's in quite a lot of pain and they're trying to recover, where would anti-inflammatories, like taking Voltaren and stuff like that, where would that fall?
Anti-inflammatories are a very tricky one, and everyone I think has different opinions on this. So when you first done an injury in say the first 2 weeks, so that it's what we would call an acute injury, I wouldn't recommend taking anti-inflammatories. The reason for that is that anti-inflammatories, as the name suggests, is that it stops inflammation in the area that's injured. The benefit of inflammation is that it sends these chemicals to your brain, telling your brain that something is actually injured and to fix it, basically. As well as that, inflammation in the joint or the area that you've injured, it causes pain, and pain is there to stop you from moving that joint so that you don't do any further damage.
It's a pretty good system.
Yeah, like it's a natural process, and inflammation is supposed to happen in an acute injury when you've just done something. So like it's there for a reason. You don't want to stop that process, and anti-inflammatories will stop that process in that initial phase. If you're looking at something where it's chronic pain and it's been going on for, say, longer than 3 months, and the inflammation is still there and it shouldn't be there, ideally inflammation should settle down after 21 days. Usually it's the worst in those first 10 days, and then it starts to decrease. After 21 days, it should be down in a normal healing process. So if you've still got inflammation after 3 months, and you've still got pain, something's not quite right, something's not quite working properly. Maybe anti-inflammatories will help you a little bit. You don't want to have long-term use of anti-inflammatories because you can get ulcers in your stomach. But 4 days of anti-inflammatories just to let it settle down a little bit can be really helpful for some people. But of course, speak to your doctor if you're not sure. They can also advise you on what anti-inflammatories to use, or your allied health professional. But I wouldn't use them long-term, just as a general rule.
I see people, it's very common. Oh, I've got a sore shoulder, take anti-inflammatories, and I can start training hard again.
Yeah.
And that's the thing, because you suddenly reduce that pain that you're feeling, and then you can continue to push, but the pain is there to stop you from doing the silly things that you're doing.
It's a message. It's telling your body, hang on a sec, something's not quite right. What can we do to work around that? Yeah.
Another one for do's and don'ts, and another question for you, Steph, Dr. Steph. So what about things like kinesiology tape and taping, and how can that assist with injuries and recovery?
Yeah, so kinesiology tape, look, there's not a lot of research around it at the moment, but a lot of people, they sort of say from their experience that they find it really helpful. Kinesiology tape is like a stretchy tape, and so the idea is that you lay it over the injured area, so over the muscle, and it would support that muscle. So what it basically does is it kind of lifts the fascia up off the muscle slightly, and it provides this neural response which offloads the muscle. I'm not an expert on kinesio tape, but I've definitely used it for some people.
You mean you're not a salesperson
I'm
on
not a salesperson.
Kinesiology tape? More like it.
But the benefit is it's really flexible. So if you're going into, say you're an athlete and you had a bit of a niggly shoulder and you're going into a competition on the weekend, and you're just not quite sure if it's going to hold up okay, putting kinesio tape on your shoulder might be really helpful and help you feel like you've got a little bit more support and a little bit less pressure on that joint than during the week. Some people find it really helpful, other people don't. It's going to be what works for you. Something like rigid tape, which doesn't move, is really appropriate if you're strapping, say, an ankle or you don't want a joint to move. You can definitely use it for other areas as well, but that's when you would try and keep the joint more stable so it wouldn't move, whereas kinesio tape still allows movement and full function pretty much. Just can reduce pain.
When I fractured my wrist, we didn't work together on really rehabbing or doing anything for that, which is pretty bad.
I was still at uni then. I didn't know as much as I do now.
That's okay. That's okay. But when I fractured, I think it was the 2 carpal bones, I was strapping it a lot.
Yep.
And that was helping me be able to lift overhead. But then it was pretty much 2 years into training and I was still strapping it. And if I didn't strap it, I couldn't lift. And it just goes to show how okay, that strapping probably helped at the beginning, but then how much I relied on strapping it, because structurally there was nothing, probably wrong with it after 2 years. It was definitely recovered.
Yeah, fractures heal in about 8 weeks, so it would have healed.
So psychologically, I had so much insecurity about not using the tape, and I just had to use it all the time and had to have my wrist in a certain position. And then there would be one random day that for whatever reason, I didn't tape it, and I didn't think to tape it. And I got through the whole session, and I was like, and I realized at the end I hadn't taped it. So just goes to show the power of, I guess, your mind and how much you can convince yourself if you have a certain attitude or a certain stance on some kind of, recovery strategy or recovery method, and how much that can affect your rehab and recovery long term.
Exactly. Yeah. I think we could do a whole episode on recovery strategies. Maybe we'll do that as a future one, and what recovery strategies actually work, because there's a lot of research and I have a lot of things we could talk about.
And there's a lot of myths as well.
Yeah.
And there's a lot of myths out in the community. So
yes, definitely.
Yeah.
Did you have any other questions? Audience questions? Or Brandon questions?
No one else has any questions. What was it? Wait, hold on. There was one other I was going to ask you.
Yeah.
Oh, fuck.
I'm ready.
I know you're ready. Everything's all set up. Oh, there was one more. It was...
in Brandon's brain right now, it's probably like on the Simpsons episode, and there's like the monkey clapping the cymbals in your brain.
I don't think so. But it's like that. Yeah, that's about it. That's all I have for you, Steph.
Thanks for listening in, guys. I hope you enjoyed that episode. So we'll be seeing you in 2 weeks' time. Remember to like, comment, share these episodes if you're enjoying them, and we'll see you next time.
This was Rehab Do's and Don'ts. See ya.